Congressman Michael Burgess is a Republican from the state, also a doctor, always welcome on primetime. First things first, Congressman, doctor, always good to see you. I hope you and the family are healthy.
Well, I'm back in Texas now. It was a long day. I'm glad to be home. It's always great to get back.
And everybody's okay in the family?
Oh, yeah, probably all better than we deserve.
You know, you and I, we'll test different ideas, and I don't like the politics of this. You tell me I'm getting it wrong. We go back and forth. It's not the case here. I am just worried. There but for the grace right now should not be our standard in terms of avoiding this virus. By all accounts, Abbott went out early and still doesn't want people to have to wear masks. He won't even let municipalities recommend that people or require that they wear masks, except in commercial settings. Why not? Why not mandate it everywhere, Doc?
I don't know that's entirely accurate. I think, as I saw in the news coming home today, Tarrant County, which is one of the two counties that I represent, has in fact instituted a mask order. So it's
only for commercial settings. Doctor,
well, there's a lot of local variation. Texas is a big state.
They don't have the power. They don't have the power, Congressman. Just so we're clear on the facts, and then I want your take. They weren't allowed to do anything. Now the governor allows them, county by county, to do commercial restriction on people in commercial settings, but not everywhere. That's the fact.
Look, as far as I'm concerned, the most important thing we can do to protect ourselves from this virus is social distancing. And I do that. If I cannot social distance, I wear a mask because it makes sense. And whatever the politics are, but that is how I've chosen to live my life. And I said early on in this, people are going to figure a lot of this out for themselves. When we were in an absolute lockdown, shutdown, nobody go anywhere, everyone stay at home. And yes, you'd have to make trips out to the local Walmart. It was packed. Of course, nobody was wearing a mask back then because we were told that masking was not a good idea. But I think people got the notion that, look, I can get out and be in this situation and nothing bad happens to me. So that's, where you start to build the body of knowledge. But back to Governor Abbott and to Texas, look, when he announced that we were going to begin a phased reopening in the state, he also said that he was going to be closely monitoring the things like the percent positive, the number of beds that were in use, the number of ICU beds that were available. He was monitoring, situation changed, and he dialed back the phased reopening. He did exactly what he said he was going to do. I don't know what else you would ask of him.
I would have asked him to have gone slower and waited longer and mandated the distancing and mandated masks, and he wouldn't be looking the way his state is right now. He'd be looking more like a New Jersey or a Connecticut or a New York.
I don't know how you mandate distancing. I mean, that's something each of us has to kind of govern for ourselves.
Yeah, but look, just because you can't enforce it, Congressman, doesn't mean you don't do it. We make people wear helmets on motorcycles. We make them wear seatbelts in cars, right? And that's where you only hurt yourself. Here, with the mask and the distancing, you hurt others. Come on.
Motorcycle helmets are optional. But look, the state of Texas also recognized that there were some serious problems that we were encountering during the shutdown phase. And I don't think Texas is any different from any other part of the country. Serious economic repercussions.
Right, but it's different now because it's got cases popping and it's going to have to slow down its reopening. That's going to hurt the economy too.
We damaged our hospitals by preventing any elective procedures. We killed medical practices. We've got medical personnel have been laid off because hospitals and medical practices can't cash flow.
And that is terrible. Congressman, it's terrible. Nobody should say anything but that. The idea of reopen or not was always a false choice. We must reopen. The question was always how. And one of the things that helps us do it more intelligently would be more and proper testing. You fought for that in Congress. You've got a president in your party who's against testing, but you did get a bill through to get more funding. Only 2 weeks, but that's something.
He signed the bills to increase the amount of testing.
For 2 weeks.
Look, we had a hearing. We finally had a hearing in Energy and Commerce this week where we had the principals in public health. Up and down the line, Dr. Fauci, Dr. Redfield, Dr. Hahn from the CDC, Dr. Giroir from HHS. Has the White House told you to reduce testing? No, 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 no. Down the line. So, I mean, that's
Right,
That's also
Congressman, I'm not saying
not
we're
an
not going to have a
accurate
debate
representation.
tonight about whether or not the president was lying. I'll take you at your word. He was lying when he said he told them to back off on the testing. But the mere idea that he pushes that as a message, Congressman,
It was hyperbole, but it's look, and we can
hyperbole
argue
during a
that.
pandemic, would you say it?
Look, I said early on, take this darn thing seriously.
All right, that's what I'm
When
saying.
when
That's
the
leadership.
Chinese government shut down a major city in their country, a city of 10 million people that I'd never heard of before, I told everyone around who would
Right,
listen, you better take this serious.
right. And the president said it was a hoax. And the president
No,
said it would disappear.
no, he did not. The
What?
president listened to me. The president listened to me. Look, the previous administration, when I was worried about Ebola and it showed up in my backyard, when I was worried about Zika and it showed up in my state, I never could get a travel restriction out of the White House or the State Department or CDC. This president did. And
He
he did it
says
early
the
on.
only reason we have cases is because we're testing. If you don't test, you
Oh,
won't have cases. He won't wear a mask. He keeps reinforcing the message that people don't need to wear masks. Come on, Doc. As a physician, you cannot, you wouldn't say any of the things he's saying. You wouldn't say any of them.
Anyone is prohibiting anyone from wearing a mask, and it is a good idea if you're not able to socially distance, put on a mask. Look, I want the economy of this country back. I want it back so badly because I see how badly people have been hurt. If
But
wearing a mask
you
is what's
extend the
required
pain by
to get us
extending the
back to normal,
pandemic, Congressman. The
no,
reason you fought for
wearing
more
a
money
mask
for
is what's
Congressman, the reason you fought for more money for testing, and rightly so, and soldiered through a toxic political environment to get it done, is because the more testing you get that's targeted to the areas where you need it, the faster you'll get through this. And that's how you get back to opening places up in an economy. You fight the pandemic. You don't ignore the pandemic.
no one's ignoring it, for crying out loud, because we're doing more tests today in this country. I don't know that I've ever seen a level of testing.
We've
I
never
do not
needed a
know.
level of testing like
I
this.
don't know why. Well, yes, we did. When we had Ebola, we did. When we had Zika, we did. And
Not
we
like
didn't have the
this.
test.
We didn't have
When,
anywhere near the caseload or the
when,
deaths. Come on, Doc.
oh, look, well, look, when Ebola, when that lady got on the plane, that nurse got on the
Yeah.
plane, and she was told by the CDC she could. I mean, I promise you, I fielded phone calls about Ebola tests
Yeah,
for
I
the
know.
next
But you
2
didn't have
weeks.
the death or the cases that we have. I'm glad that you guys were
But
afraid.
we didn't know at the time what the future held. Regardless, Chris, we want the country to get back. We want the economy to get back. We want people to get back to work. We want people to get their lives back. If wearing a mask is one of the things that's going to hasten that day, look, I'm all for it.
What do you mean if? What do you mean if, Doctor? Who's told you that masks aren't a part of it?
Well, look, if you can socially distance, then a mask becomes superfluous.
Right, but in a
If I
lot of
can't
places you can't do that,
I
right?
can't
Which is why
socially
your
distance,
cases are
I
jumping.
wear a mask. If I can't socially distance, I wear a mask. Look, Chris, every one of us has been humbled trying to predict the biologic behavior of this virus from the beginning. Dr. Fauci, when he was in the panel yesterday, he was challenged. You early on said we didn't need to wear a mask. He said, well, I was worried about the mask being tied up and not available for frontline healthcare personnel. Very reasonable position for him to have taken. Now the feeling is you should wear a mask if you can't socially distance. Good advice. Everyone should take that.
The president doesn't think it's good advice.
It shouldn't require me telling someone that you're mandated to do that. It is a good idea.
But if it's a good idea, then why is it a good idea for the president to say wearing a mask is an insult to him?
I don't know that I've never heard him say that. I don't know where you got that. But the biologic behavior of this virus was unknown as we got into this. Look, I'm a medical doctor. I will tell you, there several times I've been humbled by what I thought would happen. I knew a travel restriction would be a good idea. I didn't realize that Europe was also one of those areas where a travel restriction was necessary. When the president announced that in the middle of March, he was criticized for treating our allies that way. But it turns out he actually was probably a little late in that declaration. I was the first one to raise the alarm about ventilators in the middle of March in one of our rules committee
Congressman, I
hearings.
am not blaming you for being slow on this or for not recognizing the virus. I'm just saying leadership comes from the top. And if we don't start getting better, consistent messaging, we're going to see more Texases in this country.
No,
and we don't need
wait a
it.
minute. Now look, wait. Now look, let's put things in perspective. I mean, Texas has our problems. The cases have been going up. community spread in the lower Rio Grande Valley right now is a real concern of mine. That's different. It used to be the congregate living facilities. You'd have the hot spots like you had in New York. It's not like that in the lower Rio Grande Valley. It's sort of evenly distributed amongst families. And that's a real worry as we get into the summer. If it then goes into the nursing homes, that's an even
I
bigger
know. I'm
problem.
just saying you got a second week of record hospitalizations just to take testing out of the equation because hospitalizations are what they are.
Texas has had 2,200 deaths from this illness. New York had 24,000.
Yeah.
I mean, it is a different order of magnitude.
It's a different order of
We are
magnitude
moving
because
to
you had different set of
Governor-
challenges than the states had
Governor
up in the
Texas-
Northeast.
Governor of Texas, I think, has approached this. I couldn't have asked him to do much differently. And he began to open at a time when I don't think there was any question we had to open. And here's the other thing, Chris. You can only keep people bottled up for so long. We're going to lose the consent of the governed if we're not careful here.
Well, you're going to lose them if they
obviously-
keep. You're going to lose them a lot faster if they keep getting sick, Congressman. But I hear you, and I know it's a balance, and I appreciate you coming on to discuss it as always. And I really do hope you and the family stay healthy, and I hope things turn around in Texas and soon. I really do.
All right. Thanks for having me on. We'll do it again sometime. I enjoy sparring.
God bless. You're always welcome on this show. Take
right.
care, Congressman
Thanks.
Michael Burgess.